Welcome to another episode of the Move, Talk, Thrive podcast. Today, Emily and I are going to unpack research in practice. So, what is important about research? What makes research really valuable to us as clinicians? What do we do if research is contradicting our practices and how we can address that? And how can we practically implement the research that we read and see into the work that we're doing with clients? We are so excited to jump into this topic today. It is so relevant for what we do. So jump on board. Let's go.
We are child development obsessed business besties and mums, and we're here to spill all our secrets.
We have a combined 30 years experience working with children, and each episode we will bring you up-to-date research and evidence-based strategies to set your children up to thrive.
I'm Lizzy Dawson, Australian exercise physiologist.
I'm Emily Mackie, Australian speech pathologist,
And this is the Move, Talk, Thrive podcast.
Hi everyone, welcome to another episode. Me and Lizzy are just having a big laugh because we found it incredibly funny that in the intro she said jump on board. Anyway,
It's so Orkies, isn't it? Like some of these intros and outros. I don't know if you watches the videos, but you'll probably see our facials when both of us do these intros and outros. We're like, oh, was that what I should have said. Anyway,
process of
get the
learning.
point. You get the point.
We're starting the episode laughing, although research can be quite a dry topic. We're here to change that. Research does not need to be a dry topic.
I love research. Research has been such a foundation for my confidence, I think. It's been, really important piece of my journey and career.
Yeah, so that's interesting. I have always hated the research. Not research in terms of the result of the research, but the process. I feel like at uni, well, it probably comes back to the fact that I did struggle with theories and I did struggle theoretically. I was more a practical learner. So that really like formed my opinion of I hated academia. I hated uni. And I mean, I was only 19 then, so probably not very mature in terms of making decisions about how I view things and how I view the world. But I have grown to love the research over time and over many years. But yes, research is very important. It holds a very significant place. But that's what we're going to chat about today, aren't we? Like, where is the place for research and what place? How should we hold it in our hands as clinicians?
Absolutely. Like I think for me, I mean, that's what, as I said, was the foundation to my confidence, but really stepping into pediatrics as an exercise physiologist when it wasn't really an area that we were working in. But I started my business. I started looking at the research because there's no courses. And I was like, oh, I'm doing this. I'm doing this. And it was like starting conversations with yourself, and just realizing how holistic the intervention that I was providing was. And so it was, it has been such a huge piece in me kind of stepping into what I do really. So,
And it's very different. You just said like there was such a lack of research in pediatrics for EPs. Is that right?
no, there was a lack of courses and we didn't do it. So I kind of manually looked at the research myself. So I gathered the research myself. And that gave me real confidence because I was like, oh, I'm doing that. I'm doing that. And then I just went into like this whole of research. And that's why, like, that's how I created my course, is just from reading so much research. And I have continued to do that because I just get so excited when I read the research. And as we know, I have embarked on some research with the University of Queensland last year, and it's still going this year. And that is to gather data on my Kids Heart Pilates program. And it's kind of in my career plan at some stage because of my journey with research to do a PhD, because I've just loved it.
Yeah, I think what you've said there is really good for people to hear because it research can be really hard to unpack. So it's great that you've actually then like that's a big skill to take the research and put it into layman's terms. And that's why we do need courses, like yours, because sometimes when I used to read the studies, I'd be like, how do I apply this to my practice? How do I apply this to, the child sitting in front of me? And that's a skill, I think, to be able to then decode to every day.
Yeah, and it's been really interesting. My process with a UQ in doing the research has been really interesting because I'm obviously coming from a business perspective where I need it to be easy to implement the
Mm.
outcomes that we're recording. Otherwise, it's not going to be practical for me and my business. So I have sat down with them and we have kind of put it together so that is something that I can pick up and use in my business and gather data on my own, because that is what is going to be really powerful for
Mm.
me in a way of implementing what the tracking and then the data at the other end of it. So, but that is not to say that all research is made that way, because sometimes the way that they're going to capture data is going to be in a way that's going to get really conclusive and really good data, but it may not be practical in
Mm.
terms of putting it into therapy,
Mm.
if that
Yeah.
makes sense.
And that's what we sort of want to unpack is because a lot of clinicians either struggle to make sense of the research to then put it into practice, or like me, I was like that. Other clinicians, they then follow the research to a T, and then they struggle with flexibility when a child doesn't fit the research because, every child's unique and the research is very structured. And I guess then I feel like as allied health professionals, sometimes we just struggle because we have been drilled in at uni to think that research is the rule book. But when you get out into the real world, you're like, actually, the research is a guide. It's not a rule book. So if you're in one of those boats today, like we're speaking to you, and we want to sort of help you unpack and maybe give you some practical strategies of what to do in those different scenarios. So I've had a couple of people approach me in the last couple of weeks saying that, I've been following this program for therapy. This is what the research said to do. This was what the parameters were. And now my child has stopped making progress, or the progress is very small, or the child is doing something that is completely unexpected. And they're just feeling like at a really loose end. What do I do? They're struggling with troubleshooting and knowing where to go. Also, then going, is this me as a clinician? And thinking it's on them. And so, I've had a couple of people say that. I'm thinking this is a theme, right? Like maybe this is what you go through in your journey at the start. So if that's you, we're speaking to you today as well.
Totally. And I think that the really important thing is not all research is created equal. Uh, so I think that you need to be, it's not like one research article is going to be the basis of a protocol or, a theory. But I think that research is the foundation that creates the evidence to what we practice. So, I mean, what we do is evidence-based, but that is not coming from an odd article here or there. It's an abundance of research done in a lot of different ways, which then, makes it really, really valid in terms of what the outcome is. I think that research plays a really important role in that evidence-based practice. I think it plays a really critical role in funding
Mm.
and government decisions, which is why I really like it, because I want to be a part or be contributing to the decisions that governments are making. And I think that research uh, is what is going to contribute to that, because I think decisions need to be based on evidence, and that's what they do. But in saying that, I think we need to, open our perspective and not be guided off, one research paper. You quite often will read research papers, and at the bottom it will have like further recommendations, and it always says, further study or data will strengthen, it's recommended that, ongoing data is captured in this area.
Yeah.
So I think that that's really important. And like I said, with the UQ stuff, I think that we need to be able to, some of it is not going to be implemented in a clinical setting straight up from the research. So we need to be able to absorb it and understand it, and then discern how it will work in a clinical practice.
I mean, that's probably where the research can improve, right? Trying to make it more practical and real world. It's hard to know to get results.
It's tricky because the research is there to, like, they will put together, like, what a researcher's objectives is to get data and like valid data. Our objective is to implement it into clinical practice. We've got two completely different perspectives and intentions in what we're doing. I think it's probably our responsibility as leaders to be able to read that and make it understandable for our teams, or, practical in the way that we implement it. And I think, that's what my course is. I'm sure it's what your course is about. Going, okay, this is what I know to be true. This is the research. And then this is how we make it practical so that all of you can use it.
That's what I have in my PLA. I have a mini evidence-based practice course. But I like what you said there about evidence-based practice and how you don't just go off one article, you would pull lots of different things. And even to me, those words like evidence-based practice, like practice is a verb, and that's something that we always do. We should always be practicing being evidence-based. So if you sort of flip that around and look at what it actually means, it's like ongoing learning, like continual learning across your professional career, in knowing what the latest evidence is. And with the research, do you think that so I find like the research can be based on like trends, because it's like so the research, although these days I'm reading research papers and they can be quite small, like it can be based on 5 children, but for the most part, it's like general trends on a really large group of children or a large cohort. And so because it's such a large group, that sort of either sets the trend or it's investigating something that is happening over a big group of children. And so sometimes I find that they then, because it's such a big group, they pull the averages. So it's really difficult to then apply a big group thing to one specific child, but then the research is not valid enough if you've only used one child.
Yeah, interestingly, when I sat down with the researchers, they said to me, we're better off using a smaller group and getting more data on that smaller group, which was the opposite to what I had thought. And I was like, we're working with 1,000 kids a week. This is going to be awesome. But they're like, no, we actually just want to use one group. I'm like, what? Why? I've got all these kids. But from an amount of data that you're going to collect, and again, the thing that we kind of had to think about in terms of research with kids is, the protocol and actually gathering the data, and how, realistic are we in actually being able to get this data and engaging these kids to get accurate data as well. So, which is, I guess, then transferable into clinical practice. So for me, the big driver was, one, I want to get data on my program, but two, I wanted to really put together a comprehensive assessment protocol for exercise physiologists, which we're still kind of unpacking. And for me, it's been a really nice journey, because I've got the data through this research, and then I've got a clinic full of children that we're implementing it with, we're not actually using a heap that's the same, which is really interesting because it's really about what is kind of practically possible in terms of who you're gathering the data from.
And often research, I mean, I'm not a research side. I don't know. You're better at me, Lizzie, than saying this, but is research happening in like a fairly controlled environment? So it doesn't reflect real life therapy or home situations as we're probably experiencing it in the real world,
Yeah.
would you
Yeah.
say?
I would say, but then at the same time, I'm like, when we're gathering the data, you know, it's still kind of the same situation. Like you're still asking a child to stand and balance on one foot or to, jump as far as they can and do that 3 times. It's not like totally different.
Mm,
But I mean, it's very different from a non-therapy session. Like it's very different from at home,
mm.
definitely. But we're still asking them to do similar sort of things between what we would do maybe in an assessment and what we would do not maybe ongoing therapy, but in an assessment.
Mm.
Kind of similar, not totally dissimilar anyway.
I mean, even that, yours is just one study out of everything. And we're saying don't just look at one study, right?
Yeah,
Um,
this is just my experience with what but as I said, we've got a specific goal in mind. So
I think even in that, right? So it's realizing that researchers, they have a theory or an assumption, I don't know what you call it, assumption or a bias that they set out to prove. So researchers have an agenda that they want to investigate.
so I will I will
Correct me?
say, yeah, because I have an agenda as a business to engage a university to test my program. So I have an agenda. Their agenda is to assess an outcome either way. So they're not trying to prove something. They're very open-ended. So it was kind of they can't go in and say, we believe this. They have to go and say, if I'm remembering correctly, it was like, we're testing and it's either way, if that makes sense.
Yeah, well, I feel like they have to be open.
Ethically, they do.
Yes, because you're not sure what the result's going to be, but they would have some sort of idea or like they've identified a gap.
Hypothesis.
Hypothesis. You can tell I'm
Yeah.
not a researcher. I'm not used to using the words. They would have a hypothesis that they're wanting to test.
Which is
And so
based
some,
on previous
yes,
research.
yes. So if we're looking at that like practically, like if you're a clinician and you're looking at a child in front of you and trying to follow the research, that is sometimes why you might not be seeing what the research is saying if you've done a systematic review or you're using one approach or one paper or whatever you're doing, that is why it may not always your child may not always progress because you have a different aim or a different goal, or there's lots of other factors going on as well, which is different to when they did the paper, the researchers. And obviously, we can look at time and years and population changes and things like that as well as we're looking at trends. So it always is good to have the latest, but sometimes you can't find, recent articles about something if you're doing, something that's super nichey.
And I think no two children or people are going to be the same. So no, like children, like obviously there's normative data and that's coming from research, but just because it's evidence-based or there's evidence to say X, Y, and Z doesn't mean a child is going to follow that trend.
No, and that's variability with children and their development. And that's why we have an age range. Like even with physical motor milestones, when children are learning to walk, it's like between 10 and 18 months because
Yeah.
there's no one child that's the same. And there's so many factors that influence, like genetics, personality, motivation, external environments, home, parents. Even if you've accessed early intervention and you haven't, like that is a major contributing factor to a child's development and how they progress and improve. So even if a child has two children have the same diagnosis, it's going to look very different. So if you're in your therapy journey and you're doing whatever program you are, whether it's stuttering language from a speech point of view, if you're trying to assess and treat and do different conditions as an EP or an OT, you know, your child, you have to look at the whole picture. So the evidence and the research is one component of that. It's looking at like the external factors. And this is like from a macro level and a micro level. So it's looking at the macro level is okay, what's happening like on the big picture with the family. But then on a micro level, it's going, okay, what happened 5 minutes before the session? What happened that day before your session, or, in that month, maybe of your sessions, of what's impacting the child? Like that's micro and macro, and looking at the whole picture and looking at what's the influences at play there externally, internally, also with you as well as a clinician. You're a key part of the therapy journey.
Yeah, I think that the research is just part of the picture, isn't it?
Yeah.
It's about being able to piece that and then looking at, what is in front of you and being led by that person in front of you, and then being able to combine the two to facilitate what you're trying to do, in, as you said, including yourself and the
Mm.
environment and the person.
Mm.
But I think it's important to, because sometimes we can be so um, tied to the research because we are clinical clinicians.
And sometimes you might be afraid to move out away from something if you're not sure of what you're doing. You don't want to, you've got the best intentions in mind, but sometimes you might struggle to be a bit flexible because you want to do what the research says and follow the procedure.
Yeah, so I guess a good thing to start with is, how do we identify what a good research is? And because not all, like as we said, not all research is going to be the same. So what makes a good research article that you should be exploring further?
What's your answer to that, Lizzie?
So I think a peer review, obviously, peer review article. And then I think you can look at what the obviously the age range, like, is it applicable to what you're doing? So
Mm.
is there, is the data coming from something that is going to be relevant to you? Is there other research on it? So I will quite often, like I said, go into like a research hole where I'm looking at one article and then it's got similar articles, and then you go into, or I look at the references. And I think also looking at, how they're capturing data. Is that something that you can make practical to you? I'm just trying to think of like other instances where I've read it and I'm like, no, that's not going to work. I think those future recommendations really assist me as well. Like if they say, I can't remember what the terminology is, at at the end, there's like a, like,
Like limitations,
yes, that's
limitations
it.
and
Yeah.
recommendations. Yeah.
Yeah, I think that's really important as well. Um, but yeah, for me, I don't look at one article. I'll look at lots of different articles and find a trend between articles.
Mm, mm. I look at if it has a good literature review. I think that's an important component of it.
Yes.
Some papers do a lot more. Some papers do like less in terms of like length, but it's more the quality of that and like all the different studies that they're pulling on and all the different facets that they're exploring in that. And I love to read that literature review anyway, because it's like education in itself.
Yeah.
And I mean, I'm not a researcher. I'm not in that world a lot, but I know that there's different levels of methodology. So, the different methods that have reliability and validity,
Yeah.
validity. I know that sort of stuff with assessments because I look at that for speechy assessments as to how reliable they are and how valid they are.
Yeah.
But I guess you can also apply that to research. Um, and I think as well, like how many other papers are saying the same thing. I think, if you've got one paper saying one thing and then 10 papers saying the opposite, you're going to go with the 10 that are saying the opposite. So I guess that's where the literature review is so important, right?
Yeah.
Do you think it matters? This is just a question. Do you like I always look at certain journals that I know that are reputable
Mm.
and sources. Do you think that plays a huge component?
Yeah, I think so.
Yeah. Okay. Because
Yeah, I think so.
does we have journals that obviously like Speech Pathology Australia recommend, and you can sort of get a list and through University of Sydney and things like that. But so I sort of stick to maybe about 10. There's a
Mm.
list of 10 journals in there. They're all focused on communication, obviously for speeches.
Mm.
Um, so
Yeah, I
because
didn't
I
do
kind of
that.
know
That's
those
really
journals
interesting.
are going to only going to publish decent studies. But I don't know if that was drilled into me at uni or where I got that thought from.
Mm.
Um,
Yeah, it's a good point.
yeah. Uh, anyway, that's just a point. Like
Yeah, I think that is a good point.
in my evidence-based course for the PLA, I have listed all the journals there that I sort of go to and use for speeches to encourage that sort of, well, to help guide them on sort of the top places that you can go to get the research. Because at uni, I just used to I mean, I went to uni when it wasn't as savvy as what it is now, like with
Mm.
technology and stuff. And I used to sit there and like type in random things.
Mm.
Um, so I don't know like whether they've got more honed in journal searches and stuff these days. I'm
Yeah.
sure they do.
Yeah, yeah.
But it's
I think it's a
specific
really valid
journal.
point though. Yeah, I'm not sure if different journals would have different criteria for
Surely
uh,
they would,
yeah,
because that's what makes
something
journals.
worth looking at, I think.
Yeah. Anyway, make sure you've got
Yeah.
credible
Side
sources.
topic.
Make sure we can do another episode on that. Make sure you've got credible sources, which I can recommend, like the one that Speech Pathology puts out, Journal of Speech, Language and Hearing. Anything that's attached to ASHA, the American Speech Pathology Association, those sorts of things for speeches are good.
Mhm.
There's a lot of communication disorders and things like that.
I've got some other notes here. So looking at the study design, so you can have obviously randomized control trials, you can have literature reviews. So there's obviously different designs.
Mhm.
Another one is obviously sample size, but I
We've just
thought,
talked about
okay,
that.
this is
Yeah.
interesting. So just I guess that's just a consideration, and that was something that really surprised me. So I think worth noting that
Well, what I
you
what I would do with that is I would go, okay, so if I'm going to apply this in my therapy session, I'm aware that they only had a very small sample size.
yeah,
So either it's going to be really quality data, like you said, because they're honing it on very specific topics,
yeah,
or I'm very prepared that it may not work for my child because it was such a small cohort that they
yeah,
tested. That's
yeah,
sort of my perspective in approaching that.
yeah. I've also got here transparent methodology. So making sure that you've got detail on how it was all conducted,
Mm.
who was included and how the data was analyzed, looking at conflicts of interest. So obviously some companies are going to fund research, which is what I'm doing. So I think that is obviously quite important to look at as well.
Mm. Very important. So there's a lot of thoughts there. Um, which should hopefully help you decipher, which study to use and what to do with the research. Like we said, research is a guide, it's not the rule book. And if your child isn't progressing, the best thing we'd probably do is to fall back on your personal skills, which is communication, rapport, your values, transparency, vulnerability. Take it to a mentor, and get some help, right? So if you're not sure, I think the best place to be is curious, like we always talk about in this podcast, being curious about, okay, this is not working. Why is this not working? Let me go and chat with maybe someone who's got a little bit more clinical experience, or, someone who's in the research field to get a bit more of an idea about what's happening. That would be like an example of troubleshooting, or that would be a strategy to troubleshoot. Another strategy to troubleshoot is to look at other papers or find more recent papers. Being February 2025 or March 2025, there is stuff from January 2025 you can find. So find as much recent evidence as possible.
Yeah.
And I think as well, it's also like it is okay to feel like it is good for you to feel like, okay, this is not working. What I'm doing, I'm not really sure where I'm going, because that's like your feelings are guiding you to be like, okay, do we need to change approaches? What is the clinical decision here? Do we need to seek further assessment? Do we need to pivot? Do we need to continue? Do I need to have a chat? So it's like being okay with those feelings and going, okay, these feelings are healthy. They are guiding me as a clinician right now to achieve the best outcomes for my child, because I'm figuring out what to do. I'm not just being like going like a textbook and rote learning. I'm adjusting to the individual child.
Absolutely. I think we need to be flexible in our approach. I think one way that we can implement research protocols or evidence from research is to take small components of it that is going to fit into what we are doing. We don't have to go and replicate a research study in our assessment. We can take one part of it out with one methodology or theory behind it and apply it to a child in an appropriate way. It doesn't need to be, because we are not part of a research, right? So it's not going to come down to it all being controlled. So I think that you can take the approach and you can modify it, because remember as well, unless you are diagnosing where you've got set criteria that you are which you guys would be all over in your assessments. If we're just doing a progress report, though, we can we can measure that based on their previous, for us, like it could be just standing, long jump, or a balance, and then measure that progress. It could be on behavioral tendencies. It can be on transition. It doesn't need to be like a set protocol, because we can measure progress without a set protocol. So
We
we can
can
still,
measure progress by actually looking at what the child's doing in the session
yeah,
and being guided by them. Yeah.
yeah, absolutely. So I think it's really that personal approach, and like what we're always saying, that client connection,
Yeah.
not over clinical, but before clinical.
I was saying to you before, is clinical intuition a word? Because
Yeah.
I feel like that's what we're talking about. That's what you're describing. That's what I was saying about the feelings. It's like using the research while still personalizing it to the child and looking at what's happening in front of you, because no two children are unique. And so I liked the word intuition, because that's like your feeling or your gut, and that plays an important role in the situation, when you're in that situation in therapy. But also we need to have our clinical skills and we need to know what the evidence says, but we put it all together to have nice clinical intuition, if that's a term.
Yeah, well, it was interesting when we were talking about it. I was like, oh, I love that. You got to explain that. That is so uh
Like best
relevant,
of both
right?
worlds. Yeah.
Yeah, it's like the bringing together that, gut personal connection with your clinical mind,
Mm.
which I think my experience and what I always say with those new grads is, is essentially trying to push them in that direction of that intuitive therapy. Because it can be really easy to go, oh, but the evidence is saying this. I'm a clinician. I need to do it this way. But is that getting us to where we need to be getting with that person or that child or that client?
That's
Is that going to have them coming to therapy? Because at the end of the day, the most important thing is that they're getting the therapy and they're making progress. So what do we need to be doing to do that? I've just had some really good feedback from Kids Heart Pilates. I get really good feedback from Kids Heart Pilates all the time, and also Northside. But Kids Heart Pilates, we did a holiday program, and just like the feedback was nuts. Like everyone was like, oh my God, they loved it. The kids loved it. And we're now getting it on our group programs. And my friend brought her daughter in yesterday, and she dropped her son off this morning. And she's like, I sat down with Sophie, who's 9, and I was like, why is it so good? Why do you love it? I need to give Lizzy this feedback. And she said, it was just really fun to go and exercise in a fun way and not be kind of like really rigid. Like it was just fun. It was nice to know that I could exercise and have fun while doing it. And I think that's kind of the undertone to everything we do. And I was talking to my girls this morning and I said, this is one of our values, is to have fun, because we know that when we're having fun, the kids are going to want to come. And when they come, then we can layer in the therapy principles. So then we can apply that, that evidence-based practice, but they need to be having fun first.
Absolutely.
So that's kind of that nice balance between it.
Yes. Well, children learn through play.
Totally.
That's
funny
amazing. That's so good. If you're not sure, ask the child. If you're not sure what's happening, if they're old enough, ask them as well. Consult your clients. We're probably thinking of the younger kids when we're talking about this episode, but if your child's old enough, have a discussion with them and be like, what's happening? Have that vulnerable conversation with them, which is going to empower them and actually help them feel seen and like they belong.
Yeah, totally. How do you get that feedback? Because, speech is a little bit different because that's more therapy based. Like it's a more therapeutic practice than I would say what we're doing with exercise fit. Is like we are still, like it's still therapy, but it's, it's more play-like because we're moving. So we're doing obstacle courses. Like I know when I take Flinny to speech, they're doing games, and I know that parents will be like, oh, you're playing games. Like that's not speech therapy. And that's what they do with us as well. But I know that it is more, it does feel more like therapy than exercise phys would. So how do you kind of get around that?
Well, I think it depends on what you're targeting, what area you're targeting. So with Flinny, you're doing speech sounds. So that's can be a little bit more drill and repetition and repeat, because it's all about we try to aim for 100 repetitions every session or more. So that is a little bit more structured, definitely. But with your early language children, with your preschool language, it is a lot more play-based, a lot more. And I have the objects hierarchy in the PLA, which is use your body, use the furniture around you, use your environment, everyday items, toys, that sort of thing, use our bodies. So it depends on what area you're targeting. Whereas if you're targeting literacy, like that's obviously sit at the table. Or like pre-literacy can be a little bit more flexible, but literacy is like we're writing, we're reading, that kind of school-based activity type learning. So it really depends. But you've always got to be chatting to the parent and going, is this suiting the child? Is this not? Because, but you'll know anyway whether you're getting progress or not, whether you're having challenging behavior coming up in the sessions or not. And it's just being really flexible. And I think, honestly, with speeches, it's being really creative with how you teach children and how you manage the behavior. I'm saying challenging behavior, but sometimes like you might have a child who's sitting so still and they're not speaking. Like that's behavior as well. Like
Yes.
it's challenging, but they're not like around the room throwing stuff, you know. It's really like working with the behavior that you're seeing and creating that connection with the child. That is always my approach when I'm working with children.
And that is the clinical intuition, isn't it?
Yeah.
Like
Yes.
really. I've just
Yeah.
got a definition here when we were talking before. It says clinical intuition has been long debated. To date, there is still no accurate definition. It's been said that experienced older physicians more commonly rely on clinical intuition, whereas novices prefer evidence-based medicine. How many of us have had that gut feeling point towards a decision that did not follow a rational explanation in the management of a patient?
Yeah. Yeah. And I guess probably what I'd recommend to people who are starting out is to try and not shortcut that process, but try and be aware of that and try to be more flexible. Like I wish someone had told me that when I was starting out in my journey. I probably would have been a little bit more structured than what I am now.
Mm,
Just because of what you've just said, like, you know, you're not really wanting to trust yourself, but you know, your experiences are all valid and your experience matters, even if the experience that you get on placements, the experience that you've had in your personal life, and you've got to bring that all to therapy as well, not think, oh, I've got to put that on the back burner because I've only got a year's experience. Like you know, you have to bring that intuition with you as well.
absolutely. And I think that's, coming off our previous conversations in previous weeks around meetings and one-on-one, this is the sort of stuff that if you're feeling it and your clinical intuition is coming up, then you're speaking to your mentor or who you're reporting to unpack it
Mm.
if you're still not feeling confident to
Mm.
follow it. It
Mm.
takes practice.
Yes, and that's the thing, right? So knowing when to seek help, knowing what to do to troubleshoot.
Clever.
Um, yeah, so I mean, I guess progress isn't always linear. We all know we know that, but it's actually knowing that in the moment when you're with your child in the session, knowing that the research can look different in real life practical therapy sessions because every child is different. We would encourage you to try to stay flexible but connected to the child. So connected to the child rather than connected to the study or the data or the results. You know, staying connected to what is happening in front of you, what is the situation, looking at all the different facets and the big picture of therapy, macro and micro, having vulnerable conversations, going to a mentor, and just trying, I guess it's trying to have, I don't know if it's a balance, but trying to have an evidence informed practice as a verb
Yeah.
in your therapy sessions, evidence-based practice or evidence informed practice in your sessions, you know, as an action.
Yeah.
And knowing that you're never going to know everything and that the thing with working with children is they will always trip you up because that's children. They are unique and they're different. And, you know, we're working with children who have difficulties. And so that brings another level of interest or intrigue to our sessions and our therapy. But that is what makes it so rewarding. The profession so rewarding is because when you have a challenge in front of you, you are able to pivot, troubleshoot, and work through that. And then that is the most rewarding thing, seeing that progress with your child. So we hope that this discussion about the research and, you know, we've gone in a few different tangents and topics today, but we hope it's been really helpful for you and enlightening. If you have any feedback for us or one thing that you've learned, send a DM to the Move Talk Thrive podcast page, and we will be back in your ears next Monday. Have a great week.
Bye.